This is a situation where we're shooting a picture that shows the problem of stitches that are close to the eye. First thing is that any wound should not pull the eyelid down. And if the eyelid's down, then there's a problem. That's called ectropion, and ectropion needs to be dealt with quickly. Next thing is there's still a little bit of pinpoint bleeding on this eyelid. The skin is rather red and she's going to bleed some more, so I have to add some extra stitches called bolster stitches, and they'll probably be put in down through here, and they'll make this pucker up, so they're also referred to as pucker stitches. Those stitches need to come out early. As you can see, the picture's changed a little bit. We have some extra stitches added through here, and it's made this area pucker up. That's to prevent bleeding. Will it do it? Absolutely no. There will be some bleeding, and in a few minutes we'll tell you about the ice trick. But at this point, this will help restrain bleeding and make it less likely to do so by adding these stitches. The problem with these stitches are that they can be painful. They do need to come out sometimes earlier than the rest of the stitches go down this line. Because of this, we usually tell you to call us if there's a problem, and at the same time sometimes we can predict when stitches need to come out. In this case, I'm going to ask her to come back in 2 days to get these various stitches out. Sometimes on the eyelid some of the other stitches can come out too in 2 days. Sometimes all of them can. It depends a lot on the person's texture of the skin, how wide the area was that was removed, and so on and so on. Speaking of black eyes, is a black eye bad? No, but it's not good either. Sometimes it can be unpleasant. Of course, it's unsightly. Therefore, that's why we're going to tell you about ice, and that's why these bolster stitches are in. If you do have a black eye, you ought to report it and tell us what's going on, how wide it is. Is it the black eye down this way? Is it above? Another thing to remember about black eyes are once you get them, it's blood that causes the black eye, blood under the skin, and as time goes, the blood will begin to move down the face. People call up quite often alarmed that it seems like things are getting bigger, they're spreading. Actually, that's just the blood moving. That's a good thing.
To help prevent a black eye, as you remember, this patient had one from a tiny biopsy done. Bleeding may occur, so when you start to feel the numbness wearing off, it's a tingling sensation. We'll give you a glove to put ice in, and you put ice in 2 teaspoons of salt, and then tie it up somehow and place it directly onto the bandage. And you do it for 15 minutes every hour until you go to bed to help prevent any swelling or bleeding. The ice will constrict the blood vessels, which helps minimize bleeding.